All right. Thank y'all so much for joining us on here. I'm sure we're going to have some people jumping on, jumping off. I'm going to give a quick introduction, and then I will mute myself to let Dr. Latorre speak. So a couple of things. He is the medical director for the Mississippi Division of Medicaid. Thank you, Matt, for helping set this up for us. He served as medical director for the Mississippi Division of Medicaid since November 2018. He is a board-certified family physician, busy man, earned his medical degree at the University of Puerto Rico School of Medicine, and completed his residency training at UMC in 2011 while he was serving as chief resident for the Department of Family Medicine. For the past 6 years, he has practiced as a family physician in Vicksburg, and as I understand, Wednesdays are one of his days in Vicksburg at his clinic, where he continues to work part-time in private practice. And Matt also mentioned that he has been working with Dr. Thomas Dobbs, the state health officer with the state's response to coronavirus. So he has been, as we all have, but him from the medical perspective as well, inundated with this. So we're excited to hear what he has to say. So I am going to mute myself. Dr. Latorre, you are free to take over.
And all of you from the Public Relations Association of Mississippi for inviting me to talk to you this afternoon. We're going to be talking about coronaviruses and the one that is affecting us now, which is coronavirus 19, and what we are doing at Medicaid as well as the health department and the medical societies and the hospitals in general. So coronaviruses have been around for quite a while. This is not the first one that we have had. When we had SARS virus, that was a coronavirus as well, and that was the 12th. We also had one that came from the Middle East. And so we have handled situations like this before. The good news is that those viruses kind of prepare us to do what we're doing now. So the health department has been preparing for this for quite a while, and they are ready, and the government is behind them, and we are coordinating our efforts with the federal government, and we are having an adequate response. We wish we had more testing equipment, and that has been ordered. So hopefully in the next several weeks, we'll get more and more, and so we can test more people as needed. Because we have limited resources when it comes to testing, we have come up with guidelines on how to test people, and that has been shared to all the physicians and nurse practitioners and physicians assistants using agencies like the Mississippi Academy of Family Medicine, Mississippi State Medical Association, Mississippi Academy of Pediatrics, and so on. So we're actively engaged. All of those associations and myself and Dr. Dobbs meet daily, and we give upgrades as we go. So far in Mississippi right now, we have, give me a second. As of this morning, 34 cases confirmed with no death, which is fantastic. The numbers are increasing fairly quickly because we're testing more people. So yesterday we had 21, and this morning we have 34, and 2 days ago we had 12. So I do expect the numbers to increase, but it's not because it's getting worse. It's because we're testing more people. So that's why we decided to do the social isolation to avoid people getting exposed to maybe an individual that has the coronavirus but is not aware that they have the coronavirus. The criteria that we're using for testing people is if they come with a fever greater than 100.4 or greater, plus respiratory symptoms and cough and difficulty breathing, and those individuals have traveled out of state to places like Washington State or New York City, or out of the country to places like Italy, or now Western Europe, as well as the Far East, including Japan, China, and I'm blanking here. South Korea. So those people will take precedence over somebody who's been, let's say, in Jackson all this time and now has upper respiratory symptoms. Also, if the patient is 65 and older and they have chronic medical conditions like COPD, hypertension, diabetes, congestive heart failure, those people are higher risk. So we test those populations as well. It doesn't mean that that if you have been around Mississippi that you cannot get it, because we have a lot of people that travel outside the state as well as abroad. So we're being very cautious, but only the people that meet this criteria right now are the ones being tested. Most people will fare well if they get the infection. It'll be like getting a flu every year. So if you get a flu, we usually give you a Tamiflu or Sofluza, which are medications that are available. When we send you home, we tell you to rest, eat well, and after you are fever-free for 24 hours without any Tylenol or Aleve or any medications like that, you're good to go. Unfortunately, for the coronavirus, we don't have a medication right now, but we do the same thing. We're asking you to go home, stay home for 2 weeks, isolate yourself, keep the surfaces clean, and after 2 weeks, the virus should run its course, and you're okay to go back at your normal life and pursue what you were doing. So those are the guidelines that we are sharing with all physicians and hospitals. We are asking our patients not to go to the ER to be tested, but to call your physician clinics and ask them, tell them your concerns. They're going to ask you the questions that I just discussed with you guys. And if you meet criteria, you will be tested. Most places, what they're doing is they're asking you to go to the parking lot. They'll come in with a full gown and do the test from your car, so you don't have to go inside and expose other people, and that you're not exposed to other illnesses. And then we are prepping that. The samples that we get, we put them in a container, and we were shipping it initially to the state health department. But now LabCorp has come on board, and Quest Labs are also on board, and they're getting the samples and running the test. With LabCorp and Quest, it takes about 4 days to get the answers back. In the meantime, we're asking the people to stay home and avoid contacting other people until we get the lab results. If your test results are negative, then you don't have anything to worry about. But if they're positive, then we're asking you to stay in isolation for 2 weeks. And we're asking also the family members to try to stay away as much as they can and keep the areas clean. And once the patient gets over, we're going to check the family to make sure that they were not infected with the virus. Is there anything else that you guys would like for me to talk?
Dr. Barnes on 102 returning a call. Dr. Barnes on 102 returning a call.
Sorry, this is working clinic.
Dr. Latorre, I had a question for you.
Yes.
What types of things are being done within the hospitals and clinics to protect the medical staff?
So what we have recommended every clinic does is that they have a designated room to test people that need to be checked indoors in the clinic, and only to utilize those rooms. And before a patient comes in, the room is cleaned with disinfectants that we have here. You can use Lysol from household. Then we take the patient in there, we do the testing. We are encouraging all our health professionals, from nurses, physicians, lab people, to wear gowns and also to wear a mask. If you don't have the N95 mask, you can use like a regular surgical mask, but we prefer the other ones. But not every clinic not every clinic has them. There's a shortage because when this started to happen, multiple people went and bought a lot, and so we don't have enough for all the clinics, but the hospitals do. And also they're wearing eye protection, and we check the patient like we would check it for anything else. and then we're doing the test. But we check our staff. We make sure that they follow all the cleaning protocols and they're wearing the appropriate gowns and discarding equipment and the gowns that are used in designated bins after we are in contact with the patient. Because until we have their results, we have to assume that everybody that we're testing for that has the possibility of having it. So we're following the universal protocol when people are infected. We're also very cognitive of our environmental group here, the people that come after we leave the clinic and clean. We don't get those because the surface for multiple anywhere in 27 on the surface. So we wipe those, right? Okay, we spray the disinfectant and leave it on. We don't. And the next morning we come and clean before somebody comes. In our clinic, we have implemented different protocol, which for our patients are coming for routine follow-ups and we clean and then we open in the afternoon for patients that are they have acute illnesses and they're going to be tested, and they still go to the same room, but we don't want to mix people who they have chronic medical conditions but healthy otherwise with people that are having upper respiratory symptoms. And this has been discussed with multiple clinics throughout the state, and we share all the information freely. At this time, it's not a time to be competing against each other, so we're all hospitals and clinics are working in coordination with the health department and our state medical association. We encourage patients, staff, if they're symptomatic, we're testing them to make sure that if they do have the virus, that they don't expose our patients or other coworkers. So if somebody's having symptoms, we immediately test them and we keep them in isolation until we have their results. This is, in a clinic like ours or in a larger hospitals, this is not very cumbersome, but in the smaller clinics, this is very challenging because sometimes, it's a doctor and a nurse and maybe 2 other people. So if you isolate somebody for 2 weeks, it doesn't interfere with the care that they can provide. Also, for our patients that are doing well, we encourage all physicians to contact them by phone or telehealth to see how they're doing and if they need any medications, to refill those medications, and have the patient, if they're doing fine, to return to clinic 2 or 3 months later when everything should be, hopefully by then it'll be gone. And that way they're not exposing people unnecessarily to infections that they don't need to get. I'm happy that the governor has approved telehealth, also the president. That's going to help to keep healthy people away from the clinics and the hospitals so they're not exposed to the virus. So that's what we're trying to do for the people in the clinic. Also, we are writing protocols for people that transport our patients. Medicaid, one of the services that Medicaid offers is we have patients that don't have transportation, but they need to go to the clinics. So we have contractors that go and pick them up at the house, take them to the clinic, and take them back home. As any of us can understand, if you're a driver and you're taking somebody and the person is coughing all over your car, you're going to get concerned that they might have coronavirus or any other ailment that they don't want to get. So we are going to share the same protocols that we do for emergency management services. So these people that are working like that, they're not going to be exposed. So that's some of the measures that we're taking for our employees, as well as people from environmental services or people with transportation, and as well as first responders like the firemen, ambulance, and police.
Dr. Latorre, what is the word on how long this thing stays on hard surfaces?
So I have seen there was a report that has like different surfaces in the, I think in metal it was anywhere between 2 to 3 hours, but it in the wood surfaces and stuff like that could be up to 24 hours. So we're assuming here in the clinic that everything is going to stay 24 hours. So after contact, I see a patient, I spray, come back. If we have to use the same room, we spray again, trying to avoid that. But it could live up to 24 hours. And that's what I'm telling everybody. Assume it's going to stay the longest amount of time, and that'll be the safest way to do. But 2 is the shortest. I had a lot of graphs I couldn't put it in the presentation, but basically what I wanted to say, we have been through this before. So I think we're going to come out ahead. Most people will do well. We are requesting the people to isolate themselves to avoid a faster spreading of the virus. In large groups, you know, you can infect a lot of people at one time. So if we all stay away and work from the house for a couple of weeks to a month, that should diminish contact to contact. And although some people are still going to get infected, there are going to be less people infected. And that will basically curve down the effect. Because after a couple of weeks, even if you're infected, you should be okay. And we're trying to do this. It is an annoyance for a lot of people, but we're trying to protect our more vulnerable populations, like our elderly patients that have conditions. And that could be my mom or, you know, anybody's parents. And then also the kids, they have, they're getting cancer treatment or they have some autoimmune diseases. Strangely enough, the virus affects more adult people than children. That's great because our children are doing fairly well, and everybody that has tested positive now has been an adult. But, you know, these are our family members or our friends. So I figure a couple of weeks or a month of headache, if it gets to save some lives, is worth the effort.
Does anybody else have any specific questions for Dr. Latorre? Anybody?
Yeah,
Thank you. Oh, go ahead.
Dr. Latorre, any sense from the health department on how long these isolation measures might be recommended or pushed?
So right now we started with 2 weeks, but discussion is that it's going to increase to about 4 weeks because depending on how people get infected, you know, if I get infected now, it'll be 2 weeks from now. But if we have been in isolation already a week, by the end of basically the curfew, I still have a week to go. So that's why we're doing that. It seems to be starting to curve down, which is a good thing, and that's what we hope, at least in our state. I think in your bigger metropolitan centers where this is a little bit more challenging, it's going to be more difficult to curve down. But at least for us, it's going to work out. Also, I think Governor Reeves is activated the National Guard, and they were going to set up some tents like we had when we had Katrina, and so they start doing more testing. There's localized areas like Hattiesburg. The Hattiesburg clinic is very big in that area, and they set up a cough and fever clinic that you can go and be tested. I figure if the cases keep increasing here in Hinds and Rankin County, right now everything is in Hinds, we will see UMC in your bigger hospitals setting up something like that people can be tested easier. But in the meantime, please encourage everybody to contact their doctors first, and the clinics can do the testing and then notify you if you do have it or not.
Dr. Latorre, this is Liz Dinsmore. What is there, you know, in terms of the people who you're speaking with now, as you know, are the public relations community in the state or in the Jackson metro area. So is there anything in addition to the things that we're already doing, you know, following the protocols for the 15 days to stop the spread, is there anything else that we can be doing to help with this situation?
I think everybody who's doing, doing the isolation for 2 weeks is helping a lot. Obviously, the concern is, there's some businesses that are going to be hit very hard financially, and that's devastating, and it's going to affect people. But I think right now the population is doing what they have been asked to do, and there's not more than we can ask for from you guys to do what you're doing. One thing that I'll say, and that this we can do, something that we can do is, some people don't have a large family, or they might not have a family, and they are in isolation by themselves, and that could be very taxing and boring. And if you're by yourself, it could be depressing. So if you know somebody who is in that situation, a phone call would be great. Also, if you know people that have conditions like depression or anxiety, and you're friends with them, these are nervous times, and everything is changing constantly. And for the majority of the people, we get nervous and anxious, but for somebody who has a condition like this, it's even harder. And they don't have they might feel like they don't have the immediate access to their physicians, psychiatrists, and counselors, and so that puts even more stress. So elderly family members, call them and check on them if they're isolated and they're not with you. Also, neighbors that they might be by themselves. It's just it doesn't have to be long. It's just something like, hey, we're here and we care for you. We were thinking about you. And I think that will make a huge difference to a lot of people.
Absolutely.
Dr. Latorre, I had a question about some cities are having shelter in place recommendations or ordinances. Can you tell me, is there a threshold that is triggering those announcements to be made?
What do you mean? Like
in San Francisco, where they have a shelter in place ordinance right now for, I think, like 3 weeks.
We don't, that I'm aware of, we don't have that here. And yes, go ahead.
I understand that, but is there a certain threshold that they say, okay, now we would implement that type of practice or ordinance?
No, there's not a definite number. We are, as we encounter more challenges, we're trying to implement that quickly. I think that with activating the National Guard, we'll have more resources, and we'll have areas like this that we can use. And so certainly we can take care of our homeless population so they don't get sick, and we can take better care of them. But right now we don't. If I couldn't tell you, yes, we do have something in place.
Thank you.
Yes, sir.
All right. Does anybody else have anything they want to ask him specifically? Anybody? If not, I was going to allow just to open the floor a little bit. If some people want to kind of share some things your companies are doing. Dr. Latorre, we really appreciate you lending us your time. I know you're so busy right now with everything going on, but we really appreciate it. And
well, much for your opportunity, and thank you for the work that you all do. And if I could be of any assistance, please let me know. Matt can get a hold of me at any time, and I'll be glad to help whichever way I can.
thank you so much.
Thank you.
We appreciate
Thank you so
it.
much.
Thank you, Dr. Latorre.
Yes, sir.
Thank you so much.
Y'all be safe.
You
You
too.
too.
You too. Thank you.
All right. So I wanted to just open it up if anybody had anything they wanted to share or kind of bounce off any ideas that might be a little bit more specifically public relations related about what your companies are doing, or something you kind of want to bring up to your colleagues here. Open forum discussion right now. Obviously, we're all of our things have been adjusted a little bit, whether you're working from home or, like, obviously Matt there and Liz still in the office, but busier than usual. Anybody have anything?
Hey, Matt, I had a question for you.
Yeah.
Have they talked about activating a JIC at MEMA, a Joint Information Center?
That's a good question. I haven't heard anything about it. I imagine you signed up to get their releases, right?
You know, I had them when I was at MDOT. I don't know if I have them at Entergy now.
Well, while y'all continue discussing, I'll see.
I could be wrong, Rob, but it's my understanding that they've activated at, I think they call it a level 1, which is the first time it's been activated at a level 1 since Hurricane Katrina. But don't quote me on that. Matt, double check. But I think that's the case, with the health department leading the efforts.
Awesome. And I asked that for people who don't know, the JIC is a Joint Information Center, and it's a great opportunity for public relations professionals to kind of step up and assist the state in communication efforts. So if you're interested in that, I know get with our government associated members. I know that they have more details on either signing up for that or for getting involved in that.
I do know that MEMA has canceled or postponed their exercise that they were going to be doing around the last of this month. And they were supposed to do a drill, basically, and they're postponing that till September. And it was a lot of the PR, or some of the PR schools were involved in that. I know Mississippi College, we didn't take part this year, but it was going to be some good opportunities. But hopefully that will come around in the fall.
It's good to know.
Guys, it's Leela. I just posted in the chat a link to a really good article that I saw this morning about kind of warning against tone deaf communications, especially to customers, and really being thoughtful about what you're saying, because everybody assumes that you want your people to be safe and healthy, and if you're not giving them something else of what's in it for them, you might be missing the mark with your customers. So I just wanted to share that and let y'all know I posted the link in the chat.
I read that, Leila, this morning, and it was, sorry.
I think that's a good point, and I'll go back and find that because I want to read it myself. I've heard some interesting chatter or some amusing chatter about overusing the term, continuously monitoring the situation and stuff like that.
Yep.
A good point.
This is definitely minuscule in the big scheme of things, but with homes, to try to keep our students, because today we went to full online classes, started today. Students are going up in groups, smaller groups to school if they need to get certain books or materials. But just for fun, to kind of keep them engaged, we're doing a social distancing scavenger hunt, where we're getting students to take pictures of their hand sanitizer, them washing their hands, photos of just different things, obviously not pictures in groups or anything like that, obviously, but we're going to do point system so that at some point somebody will be a winner for the most pictures, like pictures of them doing a selfie, doing their schoolwork from home, just as a way to kind of engage them and keep them following our social media, obviously for updates, which is important, but just to add something in there that's not all just, continual news. Keep it a little fun. That's just something a little different. But Liz, were you speaking? Showing you muted, but you're popping up like you were.
Oh, sorry. No, I just said I think that's a cute idea. I think that's a fun idea to, like Dr.
Oh, we're trying to
Latorre
get
was
something that's
saying.
not all doom and gloom, you know, just a
Right,
little bit of,
right. And it's a good way for them to be able to still see each other and communicate. And I know my little boy now is 10. He goes to Park Place, and some of the teachers have been posting like pictures in our school Facebook group for us to show our kids, like of them with their dogs and things like that, just uplifting things to show the kids, you know, and, you know, just telling them that they miss them and things like that. And it's really been good, I think, for the kids to see that.
yeah, I like that.
This is Patty. Our development team is doing something similar. We were to have an alumni Easter egg hunt for families at our school. And so that was one of the many events we had to cancel. And so they're going to now let families post a picture of their Easter egg hunt at their home with their children wearing gear from our school.
Aw.
So that'll be a way that they can at least, you know, participate virtually in that and still feel like they're having an event.
Yeah, that's cute.
I know we're trying to balance keeping our shelter open and keeping the public aware that we're, you know, if we get a case there, we've locked it down and figured out a way to keep quarantine, and so that we don't have to put people back out on the street. So that's kind of been an interesting challenge. And being a nonprofit, obviously trying to bring in still those donations and, hey, we need food because people are coming in for more food. So I don't know, it's just an odd time.
Yeah, Michelle, tell me again who you're with.
Salvation Army.
Salvation Army, okay.
Yeah, so we're obviously getting hit with a lot of requests for food and for bill assistance from people who are, you know, not getting paid right now and whose kids are not eating at school. So trying to balance the flow of, hey, we need donations with, hey, we're still taking care of people with, you know, trying to keep the shelter up and running, and just it's an interesting mix for sure.
I can imagine. I know that there's a really big call and a really big need for blood donations right now too, as well. I was seeing just, you know, because everybody is in isolation, so nobody's donating blood, and they're really needing blood for, you know, just the normal ongoing patients that need blood. So I guess if anybody can do that, I'm sure they have protocols in place for, you know, keeping people isolated while they give blood. But I just have been seeing a lot of, you know, the call for a desperate need for blood donations.
Mm-hmm.
What are some of y'all's biggest needs at the Salvation Army right now?
I mean, our biggest need, which is probably everyone's biggest need, is that we're trying to get, you know, hand sanitizer and cleaning things to give to our senior population who are now shut in their houses. So, you know, and then we're putting together food boxes because we have people who were used to eat here at our weekly programs and are now getting fed. So it's, you know, kind of the same needs as everybody. It's just impossible to find the stuff.
Right.
My name is Taylor, and I'm here not social distancing with Michelle because we both have to be at work.
Hi.
So one of the things that was like we've tried to reach out to some of our local grocery stores to make those food boxes because our kids who are normally in our arts and sports programs, our senior program, all of that's been postponed, and they all normally eat here, which is kind of essential. And even reaching out to some of, like, you know, grocery stores like Kroger, Walmart, they don't even have the supplies, as we all know, to even donate. So that's just kind of been a difficult challenge of, hey, it's all gone, but we still have a senior population that needs to eat and needs toilet paper just like everybody else. And the panic has caused these massive grocery stores to not even be able to distribute what they have because they don't have anything to distribute.
Wow.
So it's definitely an unfortunate kind of balance. We're just trying to kind of piecemeal boxes together to make sure those people still get fed.
Mary Margaret and others who are teaching, have you encountered any problems with students not having access to Zoom or not having high-speed internet access? I've run into that.
Not yet, but with my students, I already taught online, and my yearbook newspaper and all those, we already went through Zoom. So
Okay.
Mine were already, but this is day one, so we're kind of going to be doing some, looking into that, and we've let them know if absolutely necessary. We've talked about the possibility, since no one has come back to our library since, we were on spring break, obviously, when all this got really bad, maybe even open up the possibility of students that absolutely do not have that access being able to come in because they'd be alone and just schedule those out. Like they could have a scheduled time to work on their class there.
I was going to try to have some regularly scheduled Zoom sessions, but I think what I'm going to do is do it asynchronously now.
Yeah.
And Bill, one thing I would also say about that is with Zoom, there's the ability to just call in. So
right.
I'm not sure if some of these students, don't have a phone, so that may be the issue. But I know that's one good thing about Zoom is you don't necessarily have to have a computer. You can call in and listen.
That's a great point. Thanks.
Yeah, I think that's kind of what happened with Dr. Latorre. He's in his clinic today, correct, Matt, in Vicksburg? And
Yes, that's right.
When his laptop malfunctioned, he just went in from his phone. So sorry. We tested yesterday and we're fine and saw him in person, but that's how it goes, and I get it. He was in the middle of his clinic, so it's all good. At least we could hear. That's the part that matters, right? So there'll be a lot of figuring out for a lot of businesses, but I asked about that with Salvation Army. I was like, maybe that can be something, if you want to, Michelle, my email is mbusby@homecc.edu. I'll say maybe it could kind of be the different PRAM chapters could share on our websites if people have any access to some materials. Maybe we could kind of make that a PRAM, embrace that as kind of a community service thing. Anything anyone could help donate. It never helps, It never hurts.
Yeah, and we have
channels.
We have started putting together an Amazon list, but even on there, there's nothing that's available. So
I know nobody can get what they don't have, but you never know. Someone among us, or someone might know someone who's a massive hoarder and might have had resources they might want to share with the ones who really need it the most. So.
And that was mbusby@homes.edu?
Home CC. Yes.
CC. Okay. Perfect.
Yeah, if you'll send me that, we can get that. We can share that across our.
Absolutely.
Help with that need too.
Yeah, and Michelle, will you share your email as well, maybe in the chat? So I'm with the Methodist Children's Home, so we're in a somewhat similar situation of being nonprofits, and of course for us, school being closed means our kids are home with us.
Right.
We are the home that they come to. So I know our facilities team has been able to get some additional sanitation stuff. So I don't know, there might be information they have that we could share with y'all.
That would be great.
So I'll reach out to them. Hopefully there's some shared resources we can have there. And then if anybody knows, like y'all were talking earlier about ideas of keeping kids entertained. So we've canceled a lot of everything we do with our kids is a lot of volunteer based, but obviously we don't want more people coming on campus right now. So we have canceled all volunteers and like the programs they were running. So now we're doing more. And so we have like 30 teenagers on our campus that we're trying to obviously do school for, but also just keep entertained and keep activities going for, because it's not good when 30 teenagers get bored. So if y'all have any other items of like keeping them entertained, we're coming up with curriculum and programs and stuff. But if y'all have seen anything good out there, please send it our way as well.
All right.
I'm Hillary from the Tupelo chapter.
Okay.
And I was talking to one of my, I have a marketing agency, and I was talking to one of my vendors, and he has a vendor that manufactures our bottles hand sanitizer, and he said he can get those in like 10 days. And I'll be glad to share his contact information. He's a salesperson, so his company wasn't willing to just buy $10,000 or $15,000 worth of hand sanitizers, but if you had donors who wanted to purchase that, I don't know if that's something that you're looking for, it might be a resource. And I'll put his email in the chat.
That's a good point. I didn't think about people like brand stores and Logo USA that probably order in bulk of those. They might have some good resources to those. Never really think about that. A good opportunity for some businesses, the worst time, and some it's they're booming, you know. It depends on what you're in right now.
Well, he said he didn't want to be opportunistic, and he hadn't put anything out on social media because he was just like, I don't want people to think I'm taking advantage of a situation. But he said, but at the same time, if I've got access to something that other people need, so he's kind of really weighed the PR of that, you know, putting it out there and not seeming opportunistic, but also being able to help.
All right, thank you. No, that's good. Well, I appreciate everybody getting on here and sharing. This obviously shared a lot of good information, and if anybody has anything else, y'all are welcome to continue. I know everybody's busy with everything going on, but I appreciate y'all taking time out of your day and everybody sharing. I know I've gotten some good things out of this, and you know, any way we can all help each other is always good. So.
Thank y'all so much for doing this, Mary Margaret and Matt and the board. This has been awesome. Thank y'all so much.
So I've recorded everything, so what we can do is maybe even share this with all the chapter presidents, and that way if they want to share it among their members, it can be something, you know, that some of that information mentioned in there can be shared among everyone. So, right.
So Mary Margaret, before we go, have we given any thought to doing something like this again next month if we're still practicing social distancing?
Yeah.
Or maybe that's a question for everybody on here and our membership going forward.
Yeah. No, I mean, that's definitely something we can discuss. I mean, I guess if we're not having state PRAM, we could, you know, kind of like we had all different chapters on here today, maybe we could even in April do something like that. And maybe if we had some speakers still willing to jump on, we could have some of them, you know, speak to everyone via Zoom.
Maybe we could have Paul do that.
Yeah. I guess we'll just kind of see how it goes like everybody is right now and just hope for the best. But if not, you know, no reason to not keep meeting this way. So.
Hey, Mary Margaret.
Uh-huh.
I've seen lots of folks through the messaging function here add information and addresses and resources. Is that all like, can we all access that? Is there some way we can save all that so that everybody can see all that info?
Tell you what, I'm not 100% sure, so I'll just copy and paste it and put it in an email just to be safe.
There's in the
chat thing.
It should be saved though, but just in case, I'll copy and paste it into something so we're sure we have it.
Okay. I'm new to Zoom.
I've used it, but I've never really had to record it for later. So, but yeah, I'll make sure we keep all this so we can share this information as well.
No, that's the.
All right.
Thank you guys. This is awesome. Good job.
Yeah.
Thanks, Roz.
Great job, guys.
Thank you. Got it.
Thank y'all.
Thanks, y'all.
Y'all have a good rest of your day.
You too.
Y'all too.
Bye.